Hyperparathyroidism, or THPT, is kind of a consequence of long-term severe secondary HPT. What happens is, after the parathyroid glands have been stimulated to work overtime for so long years, usually, often in patients with severe CKD, they can change. They develop what's called autonomous function. They basically forget how to turn off.
So they just keep pumping out PTH even if the original reason is gone.
Exactly. Even if the underlying problem, like the low calcium from kidney failure, gets fixed. A classic example is after a successful kidney transplant. The new kidney starts working, calcium levels might return to normal or even go high, but the parathyroid glands, because they become autonomous, just keep churning out massive amounts of PTH.
So tertiary ends up looking a bit like primary again, but with a different history.
Precisely. The key feature of tertiary HPT is you have both high calcium and high PTH, but it developed after a period of secondary HPT. The complications are then similar to primary HPT because you again have that persistently high calcium and PTH kidney stones, bone disease, and so on.
And how do you treat tertiary HPT?
Often it requires surgery, a parathyroidectomy, because the glands are no longer responding properly to medical management. Once they become autonomous, removing the bulk of the overactive tissue is often the best way to control the calcium and PTH.